Hi and welcome. This is Vicki Shah, PA, with the American Liver Foundation, talking to you today about mental wellness. We're going to go over some mental health issues and some changes we can make at home to have a stronger mind. Let's first go over the basics of mental health. Um, the first one that we're going to talk about is that mental health is uh, contributed by multiple things throughout our day. This can be emotional or how you're feeling, psychological, how you think, and also social, interacting with others throughout your day. And it affects how we think and feel and act every single day. It's very important throughout our lifetime to have good mental health. It starts at childhood and continues through our entire life. And we always talk about physical health, but we tend not to really work on our mental health as much as we should. We know that 1 out of 5 Americans experience mental health issues sometime in their lifetime. And unfortunately, 1 out of 10 young adults do experience a period of major depression, which is not just, feeling down one day. We're talking about that can last for weeks. And 1 out of 25 Americans do live with serious mental illness, which can include schizophrenia, bipolar, and the major depression. So things that contribute to each person's mental health status. This can come from our genes, so what our mother and father gave to us, or even the way our brain chemistry or neurotransmitters work. So some of it is biological, and we have no real control over that. Another one that can really contribute to mental health is our past experiences, especially when you have had a severe trauma or abuse. And when we talk about abuse, we're not only talking about physical abuse, we're also talking about mental abuse and verbal abuse, usually seen in close relationships. When you have a family history of significant mental health issues, unfortunately, you're more prone to getting it yourself. And so taking good care of yourself is really important. I wanted to talk today about two big things that I think most of us deal with on and off throughout our lives. And one is depression. And, major depression definitely needs to be seen by a healthcare provider and even consider medication and therapy. But I'm talking more about just mild kind of depression that we might experience day to day. When it gets a little bit worse, we start to see symptoms where you might be sleeping more than you should or overeating. And also we see some people not eat enough or have insomnia, not able to sleep. Also, you start to pull away from things you usually do, family and friends, maybe going and doing fun activities that you used to like to do. You just don't have the energy to get through your day. You just are absent. You're not really present, and you don't feel like really anything matters. You can have some unexplained like joint aches or muscle pains, maybe even some headaches. You just feel off. And some people, when it gets a little bit more severe, you can start feeling helpless or hopeless. The other thing I want to talk about is another thing that most of us deal with is stress. And some of those, sometimes we don't know we're stressed or we feel overwhelmed, that it can start to present as physical symptoms. So we get headaches, and this can be tension headaches, which is due to the muscles around the head. You can also get migraines, where it's more common in females, but males can also get it. insomnia, which we talked about also with depression, but insomnia where you can't sleep because you feel like a lot is going on and you keep thinking. Overeating. You can also, this can be presented as back pain. You can have high blood pressure because one of the hormones we see elevated with stress is called cortisol. And that cortisol level can increase our blood pressure. It can increase our heart rate. And unfortunately, cortisol can also make you keep on weight. And so we want to try to eliminate stress as much as possible. We all know that stress also makes us a little bit more irritable. We tend to snap a little bit more. And the way the hormones and the cortisol levels happen makes us more prone to infection. So this makes sense because when we're run down, we haven't taken good care of ourselves, we haven't slept, we tend to get the common cold or flu. And so that's kind of your body telling you you need to slow down a little bit and take time for yourself. I wanted to go over, these are more of the mild symptoms, but we want to be very wary of certain symptoms that actually can impact our lives. And these are the ones we would be more concerned about. When you feel just very upset or very angry, confused, worried, scared, you start having arguments with family and friends, you're having severe mood swings, and that we're more concerned when it starts to cause problems in your relationships, and not just your significant others, but also just people that are close with you. If you have thoughts that just keep repeating itself in your head, and you keep remembering things and it keeps upsetting you, we're more concerned of these type of symptoms. And some of these issues can kind of make you go towards trying to eliminate those feelings by smoking, drinking, or using drugs. The other big concern we have is if you have that feeling that you just don't want to live, or you're going to harm yourself or others around you. These are things we're very concerned about. And so we're going to go over, if you have these worrisome symptoms, seeking help is really important. And at the end of the slide, I'll have some phone numbers for you and resources where this should definitely be discussed with a professional. But let's go over some things you can do at home. So we want to make some changes at home just on a daily basis. Be aware of your emotions and how you react to things. Notice through your life what makes you upset, what makes you sad, what gets you angry, and you want to recognize those so you can make changes. And if it's that the dishes aren't done and that makes you very upset, what about having a rule where if you have a dirty dish, you have to put it in the dishwasher right away? That's just a very small example, but what makes you upset and how can changes be implemented? Express your feelings in appropriate ways. When people close to you are doing something that's bothering you, you might want to discuss it instead of trying to keep the feelings of sadness and anger inside. By doing that, you might have some resentment and damage the relationship. Think before you act. When we have strong emotions, they can be very strong and kind of take over our mental thoughts. So give yourself time to cool down, remain calm, and that might prevent you from saying or doing something you might otherwise not have. So we talked about managing situations that cause you stress, but when you do have stress, learning some methods to cope with the stress. This could be exercising, taking some deep breaths, or also meditation, which can go along with yoga. You can try to also strive for a balance where we want to make sure that you're also enjoying life in addition to working, making times for things you really like to do, and adding those positive things back into your life. Taking care of your physical health also allows you to be your mental health to improve. And so we want to exercise, stay physically active, try to eat healthy meals, and making sure to get enough sleep. Abusing alcohol and drugs definitely will take a toll on your physical and mental health. A big thing is connecting with others. You know, we're very social individuals, and we need to have these positive connections with people around us. So, you know, sometimes you can set up a meet with an old friend. You can maybe try intramural sports, or there's some new apps online that, you know, you can go and meet new people and do a fun activity. But the most important thing is finding your purpose in your meeting. What makes you happy? What's important to you in your life? And spending the time doing that. And this can be anywhere from, you know, being with your family, enjoying your work, volunteering, but just really looking for things that makes you happy. Staying positive. You know, this is really important for overall mental health. You have to think about what you have, what's good in your life. And, you know, say you are trying to exercise 4 times a week and you only got to exercise 3 times a week instead. You know, don't put yourself down for making small mistakes. Or you were trying to eat healthy and then you decided to have a little piece of chocolate. That's okay. You know, don't be hard on yourself and kind of go back to your goals and reevaluate them. Make sure that these are the goals you really can adhere to. And if you can't, then make some changes. But realizing what you can do and how much you can do without impacting your physical and mental health. So as we talked about some of those worrisome symptoms earlier, also, you know, if you are doing these things at home and you're not feeling like you're getting anywhere, getting professional help, this could include a therapist, a counselor, a psychologist, and if medications are needed, even seeing a psychiatrist. The first step could be going to see your primary doctor, kind of discussing what you're feeling, and they can maybe help you with this or connect you with someone who might be able to. Also in your community, through church, or a community center, they might have counselors on site. But when we talk about those worrisome symptoms, you know, the concern is hurting yourself or others, and you feel like you need immediate help and you can't wait, always call 911. There's also our National Suicide Prevention online chat or even a phone call, and they're open all the time, every day of the year. And there's also a referral pipeline. Remember, we talked about the therapists and counselors that you can see what's in your area and where you can go. So these are some resources, and some of the information I got today is available online, and you can read a little bit more if you're interested. But definitely, if you're struggling, make sure you get help. Well, thank you for listening and being part of the American Liver Foundation, and I hope you have a good day.